know who will be speaking and in what order. First, we'll have Catherine Ushka, the chair of Tacoma-Pierce County Board of Health, Anthony L.T. Chin, MD, MPH, the Director of Health at Tacoma-Pierce County Health Department, Stephanie Dunkel, the Assistant Division Director for Communicable Disease at the Health Department, and Victoria Woodards, the Mayor of Tacoma. We're allotting roughly 30 minutes for this news conference, and toward the end, we will have an opportunity for the media to ask questions. But now we want to start things with Board Chair Ushka.
One second. Thank you and good morning. We are here to share the sad news about COVID-19 deaths at long-term care facilities here in the county today. The continued spread of the disease in our communities is why we are doing this news conference in this fashion. We're observing social distancing practices very carefully here in the auditorium. You may notice a pause as we transition people to the microphone. You don't see us wearing masks today because we are taking steps to be further than 6 feet apart at all times. And we have a limit of no more than 10 people in the auditorium. As you know, all of these measures are so that we can keep one another safe and do what we can to keep the disease from spreading any further. Staff and leadership from both of the facilities are focused on preserving the health of their residents and employees, and were not available to participate in today's news conference. Before we go any further, there's a reminder to anybody on the call to please make sure that your phones are muted anytime that you aren't actually speaking. We are going to make sure that representatives from each media outlet have an opportunity to ask a question and to ask a follow-up question, and then we'll allow more questions if time allows. Now, here's Dr. Chen to talk about the 2 county residents who have died in our long-term care facilities. Thank you.
Thank you, Board Chair Ushka. I'm Dr. Anthony Chen. I'm Director of Health of the Tacoma-Pierce County Health Department. At this time, COVID-19 or coronavirus is widespread in Pierce County. We are seeing cases in every corner of this county. We know that in 80% of the cases, people will probably have a mild illness. However, there's some people who do not, and we are especially concerned about those who are older, over age 60, or have underlying health conditions. The 2 deaths we're talking about today, one is a Tacoma woman in her 90s and a Key Peninsula man in his 80s, underscore the reason we all need to continue to follow social distancing and other measures to slow the spread of this disease. The Tacoma woman was a resident of Heartwood Extended Healthcare Facility. The Key Peninsula man was receiving care at Avamere Puget Sound Transitional Care Facility. Nursing and long-term care facilities serve a very important function in our community, and we continue to support the operators and protect the residents of long-term care facilities across the county. With that, I'm going to ask Stephanie Dunkel to come up to talk about these efforts.
Good morning. My name is Stephanie Dunkel. I'm the Assistant Division Director for Communicable Disease here at the Health Department. Our department has been responding to coronavirus since late January. Part of our initial efforts were planning, coordination, and connecting with partners to prepare for a response here in Pierce County. We've been fortunate to have time to learn about best approaches for facilities and individuals at highest risk. Our nurses have been providing guidance and information to high-risk settings since early February as more information and guidance has become available, working to assure measures were taken before cases arrived here in Pierce County. Part of this work was the development of a team of nurses and subject matter experts who can provide direct support to care facilities who serve the highest risk. These teams were developed in partnership with MultiCare and CHI Franciscan partners to provide on-site infection control guidance, testing, and investigation support to cases and contacts to minimize the spread of disease and protect those at highest risk. And right now, we have teams in the field doing this work. Late last week, we had the ability to gain additional test kits from our mass testing site. Part of this team is now able to use some of those test kits to support their work in the field and serving these high-risk facilities to allow for testing when needed. Late last Thursday, we sent out a health advisory to local providers about outbreaks in long-term care facilities, providing new and additional guidance based on the current information of COVID in our community. Partnerships are key to our work. We continue to stay in touch with our partners at both organizations and throughout our community as they work to provide safe and proactive care to their residents and safety for their staff. We ask you continue to support visitor policies and guidance provided by these facilities and take extra steps to protect your loved ones at home who may be at highest risk. I have the pleasure of introducing City of Tacoma Mayor Victoria Woodards. Thank you.
Good morning. It's a sad day in the city of Tacoma. While we've been under incredibly stressful times, having the first loss of life to COVID-19 hits us all and is very heartbreaking. I ask all of you to pray for the woman that we lost and her family during this very difficult time. I also want to take this opportunity to thank Dr. Chen and his leadership here at the Health Department. When we heard of people getting sick at this facility, our Health Department was proactive. They made sure that everyone got tested, including the staff. And so, Dr. Chen, I just want to thank you and your staff here at the Health Department for continuing to do everything you can to flatten the curve. I also want to thank the leadership at Heartwood here in Tacoma, Bob Rowe and his staff, for taking care of some of our most vulnerable residents. So I just, again, on behalf of all the citizens of Tacoma and the Tacoma City Council, want to say thank you. But I also want to take this opportunity to remind us that we all play a role in making sure that this virus does not spread. Governor Jay Inslee's Stay Home, Stay Healthy order includes vital actions that we all must take to protect one another and preserve our health. I'm calling on each and every member, and I will continue to call on you to protect yourselves and your families to make sure that we can stop the spread of this virus. Personal discipline is needed, and I certainly understand as a hugger myself how much you want to be close to and near people. But I'm just asking you for this time, please practice social distancing. Please make sure that when you go to the grocery store, you buy no more than you need. And let's make sure that we continue to take care of our entire community during this very difficult time. Tacoma will continue to stand, and while things will get more difficult before they get better, they will get better. We will survive this. We will come through this. We will be stronger than ever because we are compassionate Tacoma. We can do anything as long as we do it together. Thank you.
We will now take questions from the media. We will call on you in the order that you called in. In answering questions, we ask that you refrain from speculative questions or questions that would reveal personal information. We want to ensure patient confidentiality and privacy, and we ask that you do the same. And just another reminder about having your phones on mute if you are not speaking. With that, we will take our first question from Como Radio. Frank Lindsay, are you there?
This is Charlie Harder from Como Radio.
Okay, Charlie.
Question perhaps for Dr. Chen. As we enter this week, can you give us a take on how social distancing efforts are being adhered to and being applied in Pierce County? Are we seeing an effect from social distancing?
Hi, this is Dr. Anthony Chen. I can tell you my personal experience being out is that people seem to be doing a good job at this. However, I do hear concerns from people in the community that there are, some situations they see where people are not complying with the social distancing. I think that when you look at some of the statewide statistics about travel and traffic, that it clearly has decreased. I was out running the other night, and my route took me over I-5, and man, it was pretty empty on I-5. So, I mean, that tells you something when there's no traffic jam coming around that, I-5, Highway 16 intersection. So I'm hopeful that people are complying. As the mayor said, anyone who's not complying, I hope you listen to her message. It is very important, and the whole community has to do this together.
Thank you.
Next, we have from Como TV, Keith Eldridge. Keith, are you there?
Yes, I am. And this is a question also for Dr. Chen, and hopefully the mayor, if she can answer it. Is there a concern that people are going to let down their guard with the fact that even though we're seeing horror stories out of New York and such, that with the state sending back respirators to the federal stockpile and with the president taking away 300 beds from the federal medical stations, is there a sense of perhaps false imaging right now that people are going to let down their guard? And today the governor is going to announce a decision one way or the other on schools. So for the doctor and for the mayor, if you could address your concern that people may let down their guard.
Thank you. That's a great question. I think we have to go back and remember why we are doing these interventions. And everyone probably has heard the term flatten the curve, right? The whole thing behind flattening the curve is that we're trying to reduce a sudden peak and spread it out. Now, notice that doesn't say that we're going to necessarily have less cases. It means that we're going to spread it out so that we can handle that there's not a huge surge of people getting sick that will then get even more people sick, and it also will not overwhelm our healthcare system. I want to say that seems to be working. Our hospitals here in Pierce County are very confident about where they are. They're very prepared for this. Everyone has had a chance to learn and refine their practices. However, it still remains that if we flatten this curve through April, May, June, that a large percent of the population will still not be immune to this virus. We're just trying to delay things. We're trying to control the spread. So with the State Department of Health, we have been having conversations about how do you reopen this in a gradual fashion. I was speaking to our county executive, Dan Meyer, over the weekend, and he used the analogy that when we instituted this, we flipped the light switch. And so to extend the analogy, how do we turn the dimmer back up so that we gradually reopen things without flipping the light switch? We feel that if you flip the light switch, we might go into a big spike of cases again. So there's going to be a lot of art here about how we turn that dimmer back up so that we can gradually allow people to go back to more normal functioning and a lifestyle, but at the same time not suddenly expose a whole lot of people who are not immune to this illness. That's the science side of it. What you're talking about is more what the people are doing. And so we would urge people to say, as we gradually turn that dimmer up, people need to understand it's a gradual turn up and they cannot let their guard drop. Let me turn it over to the mayor and see if she has anything to add to that.
Thank you, Dr. Chen. And Keith, thank you for the question. I think that you all are going to be able to help us make sure that we continue to carry the message. The only way, the only reason we're being able to flatten the curve a little bit now is because of what we're doing. And what we have to remind everybody is we've got to keep doing what we're doing if we want to stay in the position that we're in now, which means not becoming New York. And so while the governor has sent the ventilators back, I think what we're saying, what we should be saying about that is that we're sending them back because New York has a bigger problem, but we should be taking advantage of the fact that we acted sooner so that we don't become a New York. So I think it sends a message, but I think it's up to us to translate what that message is. And that message is we are where we are because of what we've done. And if we want to continue to flatten the curve and not overwhelm our health systems, we have to continue doing what we're doing at the rate that we're doing it.
Thank you for that. And just so you know, I am working in isolation from home.
Glad to hear that, Keith.
Thanks for that, Keith. Next from Cairo TV, Kevin McCarty. Are you with us?
Yes, I am. Thank you, Steve. My question would be, I would imagine to Dr. Chen might be the most appropriate. The remaining tests from the drive-through testing, can you address what's being done with those tests, and are there more tests coming beyond that coming into the Pierce County area? And what's the availability going to be to people of those tests? Are we still where we were with at risk showing symptoms, or is it going to become more widespread shortly?
Thank you for that question. So the tests that you're referring to, I assume, are the very specific 1,400 test kits that we had available after the drive-through testing event that was we did in conjunction with FEMA. So those tests, as you point out, tests are still not as widely available as we would like to be able to have them. So we also made a very conscious decision that we had to prioritize where those tests went. So, for example, we're talking today about the concerns in nursing and long-term care facilities. We made sure an allocation of that went to help support investigations in nursing and long-term care facilities. We also knew that, especially in Pierce County, where we have an urban core and two very rural ends, we wanted to make sure that these tests were available to people in rural areas, to vulnerable populations like the homeless, and also to some of the small medical practices that don't have as many resources as the large healthcare systems. So you have seen in our blog post and other communications that we devised a rough breakdown of how that should be allocated. And so those test kits have been distributed to the community so that they can reach these important and vulnerable populations. The second part of your question, are there more test kits? Yes, there are more test kits coming in every day. It's just that this FEMA amount is now accounted for. So we also now are looking forward to new technology coming available. So you may be aware, for example, there's Abbott now has a point-of-care machine. Those machines, there's some promise to the state. I understand, that's what I've heard from the Department of Health. They will not be here probably for a few weeks. There also has been new recent research coming out from the Seattle area that shows that there may be other ways we can collect this test. We're looking at all of those. We're very much focused on trying to make sure that test kits are going to become more available. And the other issue, as you know, is the personal protective equipment, or PPE. But we also will be having some strategy conversations here in Pierce County about when those kits become more available, and this is the last part of your question, are we going to change who can get the test? As you know, any time that we have a scarce resource, we have to prioritize, and we've kind of gradually relaxed that as we've gone through. But right now, for example, it's still very much focused on those at highest risk and those with symptoms. So we are going to have a conversation, and then that conversation will be informed by how the test kits and the new technology show up in our county.
Thank you.
All right, next we have Q13. Q13. Q13, are you there? Perhaps we can come back to Q13. Moving on, we'll go to the News Tribune. Josephine, are you there?
Hi, Steve. Yes, I am. So I have two questions, one of which being, you guys have mentioned that there are 2 deaths, but how many cases have happened at long-term facility across Pierce County? And the other one is, in a press release, you guys had mentioned that you're keeping those who have tested positive separate from the rest of the population of these care facilities, and I wanted to know how you guys are doing that. Thanks.
We'll have Stephanie Dunkel answer your questions.
Thank you. So between these 2 facilities, we have 78 positive cases between residents and staff, and we are monitoring additional cases, single cases, in other locations at this time, but until they become an outbreak, will we work through that process. So right now, we're monitoring and supporting those locations as well. To your second question about what that looks like is we do what's called cohorting, but it's grouping. And so part of the mass testing that we can do in a location is to allow us to move well people with well people and ill people with ill people. And this is an infection control practice to allow not only staff to also participate in that activity to provide safety and separation, but also that testing provides us earlier information to do that. So when somebody does become symptomatic, we may already have been able to separate them into a better place. So separating doesn't mean that they're alone, but we're looking to help with staff and safety and the use of PPE in an effective way by making sure those that are still well and negative stay well and negative. Thank you.
And next we'll go to KNKX. Simone, are you there?
Hi, yeah. So following up on the total number of cases, you said you're waiting to report some of these other singular events, or before you call it an outbreak. What would you consider an outbreak?
Stephanie.
Thank you. Good question. So what we're looking for is transmission in a facility. So part of identifying a case is an investigation to help us monitor and test additional people that may be close contacts to understand if there's transmission or is this just an individual case. So that's part of our process with our teams out in the field to help identify the best next step for that facility or prepare for something that may be bigger. But thank you. That's Dr. Chen.
Hi, Simone. I think what I don't want to focus on the numbers. You know, our health department is a high-performing, quality-focused organization, just like many other organizations, and we're always looking to see how we can do better. What we have been doing is we are now acting proactively by learning on the lessons from Life Care in Kirkland. We have gone in early. We are doing testing. We are working in partnership with our healthcare systems. There are about 40 nursing and long-term care facilities in our county. We have contact with every one of them. They know how to reach us. If there are any cases, we're in there. And as Stephanie has mentioned, so we are really trying to get in front of this The measures that Stephanie outlined are a really good example of how public health can do things to help protect people, not only the residents of the facility, but also the staff who work in the facility, how we can control these outbreaks and prevent them from exploding. So I really want people to be focused on that we are working proactively. We are learning lessons from other parts of the state as well as other parts of the world. We're really trying to get in front of this, and we hope that we will have a much better outcome because of what we're doing.
And now to King 5. King 5, are you on the line? King 5, are you there? Hearing silence, I will say no. We have a few minutes remaining, so if there's anyone else on the line who did not get an opportunity to ask a question, you may do so now.
Hi, Steve. It's Josephine with the TNT again. Just wanted to follow up. So those who are healthy and have not tested positive, are they allowed to go home to their families, or do they have to stay at the facility?
I'll have Stephanie address that question.
Thanks. So the part of this is if they need care in a long-term care setting, we want to provide the level of care they need. So working with the facility and the facility working with the families to determine the best place for that person. So if they are negative and continue to be negative, the facility will work with us and those families to identify the best place. We want people to continue to get the care they need, and that's really important, especially in these types of settings. And that would be a conversation that those facilities would have with families. Thank you.
Is there anyone else on the line who did not get a chance to ask a question who would like to?
Steve, this is Kevin with Cairo. If I could ask it. I'm sorry.
Go ahead, Kevin.
I don't know who can address this, but can anybody comment on the load on local hospitals? I mean, we've seen discussion of the hospitals in New York and other places being overloaded. What's the load on the facilities in Pierce County right now? Are the hospitals seeing this huge influx, or are they able to manage the cases that they're having to handle, along with the same kind of traffic they'd have under ordinary circumstances?
We'll have Dr. Chen address that question.
Yes, thank you for the question. So I don't want to get too specific. I'll allow the hospitals to speak for themselves if you want direct questions to them. In my conversations in the past few weeks with both healthcare, large healthcare systems in Pierce County, they're both very confident about where they are. But want to let you know that some of the steps the governor took are working. So by stopping elective surgeries, that has significantly decreased the census in not just our hospitals, but hospitals everywhere. So that was it's doing exactly what the Department of Health and the governor intended to do. So that has brought the census down. We know that both large healthcare systems have instituted a network of triage and testing facilities throughout the county. That has worked to bring down ER volumes so that things are not crazy in the emergency rooms. So I want to say between the really good work our healthcare systems are doing in managing this, as well as the community supporting these efforts and participating in alternative ways of getting care, we are doing quite well. So the county, I'm glad to say, from what I understand, is sitting in a really good position in terms of its capacity to handle everything from emergency visits to regular hospitalizations as well as for any surge in COVID-19 patients.
And I believe I heard one other question. We have time for that.
Yeah, this is Keith from Como.
Okay.
And this is for Dr.